Bismillahirrahmanirrahim. Quote of the day is, and whoever saves the life of one person, it is as if he has saved the whole of humankind. This is the ayah from Quran. My name is Dr. Aamna Khalid and PGR Community Medicine. Today I will be presenting the topic of breastfeeding, baby-friendly hospital initiative, Kangaroo Mother care, and safe motherhood. Under the kind supervision of Professor Dr. Saira Afzal, who is Dean Institute of Public Health, Lahore. Learning objectives of this presentation will be: we will understand the concept of safe motherhood and its key components, describe benefits and physiology of breastfeeding, explain 10 steps of baby-friendly hospital initiative, understand principles and components of kangaroo mother care, recent updates, and then we will do the practice of MCQs. So first of all, we will go through safe motherhood, which is a concept that aims to ensure that every woman passes through pregnancy and childbirth safely. The mother and newborn both remain healthy. Maternal morbidity and mortality are prevented through comprehensive maternity care. It covers the continuum care from pre-pregnancy, antenatal, intranatal, and postnatal period. Magnitude of the problem: majority of the maternal deaths occur in developing countries, and most deaths happen around the time of delivery within first 24 hours postpartum, and nearly all of them are preventable with timely care. The major causes of death are the direct obstetric causes, including postpartum hemorrhage, this is the leading cause, eclampsia and preeclampsia, sepsis, obstructed labor, complications of unsafe abortion, and some indirect causes are anemia, heart disease, hepatitis, malnutrition, malaria, which is endemic in some areas. So the pillars or the components of safe motherhood are family planning, antenatal care, clean and safe delivery, emergency obstetric care. These are the postnatal care. These are the pillars based on health education and nutrition and reference system. We will go through the summary of each component. The objectives of antenatal care are the early detection of high-risk pregnancy, prevention of complications, preparation for safe delivery, health education. The essential services given in antenatal care, there are minimum 4 visits, but WHO recommends 8 contacts, blood pressure measurement, hemoglobin estimation, urine examination, tetanus toxoid immunization, iron folic acid supplementation, nutrition and birth preparedness counseling are done during the antenatal care. Uh, we also identify the high-risk pregnancies, those with age less than 18 or more than 35, short stature, previous cesarean section, hypertension, anemia, multiple pregnancies. Then the next component or pillar is the intranatal care, where delivery should be conducted by the doctor or the trained midwife or the skilled birth attendant (SBA) at a facility with basic obstetric services. And clean practices should be there in the intranatal visits. Hand washing, clean surface, sterile cord care, prevention of infections. Partograph is used for the monitoring of cervical dilatation, fetal heart rate, uterine contractions, early detection of obstructed labor. And then active management of the third stage of labor should be done with oxytocin 10 international units, controlled contraction, uterine massage, which prevents the postpartum hemorrhage. Then emergency obstetric care is another major component in the safe motherhood, which involves the availability of the perinatal antibiotics, parenteral oxytoxics, sorry, parenteral anticonvulsants, assisted vaginal delivery, manual removal of placenta, cesarean section, and blood transfusion. Availability of emergency obstetric care is the cornerstone of safe motherhood. Then the next pillar is postnatal care, because 50% of the maternal deaths occur in the first 24 hours, and neonatal deaths are also highest in this period. So the services provided are monitoring for postpartum hemorrhage, blood pressure checking for eclampsia, breastfeeding support, counseling on family planning, identification of newborn danger signs. Then there are three delays model in the provision of maternal care. The first part yeah, or first delay is in the delay in decision to seek care. That is lack of awareness, low status of women, and financial constraints. Then the second delay occurs in reaching the. I'm so sorry. I'm so sorry. The second delay occurs in reaching the facility when there are transport problems, distance, and poor roads. The third delay occurs in receiving the care after reaching the facility. Either there is lack of staff or the blood and unavailability or poor quality of services. Then the next component is family planning, which prevents too early pregnancies or too many pregnancies or too close pregnancies. It reduces the unsafe abortions. This is the major pillar of maternal mortality reduction. Strategies which can be adopted for the safe motherhood are universal access to the antenatal care, skilled birth attendants at every delivery, strengthening emergency obstetric care services, birth preparedness and complication readiness, female education and empowerment, nutritional support to the adolescent girls, family planning to avoid high-risk pregnancies. Now we move to the next component, that is kangaroo mother care, which is a method of care of low birth weight and preterm babies based on four components. The first component is continuous skin-to-skin contact, then exclusive breastfeeding, third is early discharge, and fourth is close follow-up. This is not only the positioning of the baby, but it is a complete package of care for him. So the first component, which was skin-to-skin contact, baby is kept upright on the mother's bare chest with only diaper, cap, or socks. A baby should be secured with a cloth binder, and ideally he should be kept with mother 24 hours per day. The purpose of skin-to-skin care is the thermoregulation, cardiorespiratory stability, mother-infant bonding, and early initiation of breastfeeding. Second component is the exclusive breastfeeding. Direct breastfeeding can be done on demand. If not possible, express breast milk should be given, but bottles and formula should be avoided. Why exclusive breastfeeding should be given in the kangaroo mother care? It's important because the preterm gut is immature, and breast milk prevents necrotizing and enterocolitis and sepsis and improves weight gain. Third component is the early diagnosis. Baby need not stay in the incubator for weeks, so mother becomes primary caregiver, and the care is shifted from hospital to home once the baby is stable. Benefits of early discharge are there will be less hospital infections, family involvement, and it's cost effective for the family. And the fourth component is follow-up care, regular weight monitoring, assessment of the feeding, detection of apnea, jaundice, and infection, and immunization and growth chart are done during the follow-up. Physiological basis or the mechanism for kangaroo mother care is thermal control. Mother chest temperature changes from plus minus 1 degree centigrade according to the baby need. It prevents hypothermia, which is a major killer for the low birth weight babies. Breathing stability uh, occurs through decreased apnea episodes and better oxygen saturation. Neurodevelopment occurs through less stress hormones and better sleep cycles. And immunity is increased by the colonization with the maternal flora and decreased hospital sepsis. The eligibility criteria for kangaroo mother care is that this care should be started when the weight is less than 2.5 kilogram and the baby is stable. Baby stable means that there are no severe respiratory distress, no shock, and the mother is also willing. Even father or relative can provide the kangaroo mother care. This is a step-by-step procedure that hand washing should be done initially. Baby should be in diaper and cap, placed upright between the breast of the mother, head turned to one side, secure with a binder, breastfeed frequently, and monitor temperature and breathing pattern. These are the monitorings done during the care. The temperature should be checked every 6 hours. Respiratory rate, color of the baby, weight should be checked daily, and feeding adequacy should be checked. This is the discharge criteria when the weight gain is 15 to 20 gram per day per kg per day, and the baby is feeding well, temperature is stable, and mother is confident to take care of the baby at home, then we can discharge them. So this is the evidence that kangaroo mother care leads to decrease the neonatal mortality by about 40%, decrease sepsis by 50%, decrease hypothermia by about 60%, and increase the exclusive breastfeeding rates. So now we come to the third component, that is baby-friendly hospital initiative, which is a global program of WHO and UNICEF to protect, promote, and support breastfeeding in the maternity facilities. It transforms routine hospital practices so that every mother receives skilled help for breastfeeding and formula promotion is stopped. The 10 steps are not just points, but they are operational actions that every facility must implement. So the first step is written breastfeeding policy. That the hospital must have a clear policy that should be displayed in the wards, and it should cover the early initiation. No pre-lacteals roaming in, staff must know it. We will go through the detail of every step in the further slides as well. The purpose is the institutional commitment. The second step is we should train all the staff, health staff, doctors, nurses, ayas in the wards, a minimum 20-hour trainings. The skills provided to them are the latch assessment, counseling, and expression of milk. Because without training, this initiative will fail. The third step is we have to inform all pregnant women. During antenatal visits, we have to counsel them about the benefits of breastfeeding, dangers of formula milks, positioning and attachment of the baby, and the birth plan for early breastfeeding. Then the fourth step is help initiate within 1 hour. We should provide immediate skin to skin care of baby with mother, which should delay the weighing of the bathing. assist. We should assist mother for the first latch, and this step alone can reduce neonatal deaths by 22%. Then the fifth step is show mothers how to breastfeed, like demonstrate about the positioning, attachment, and the hand expression, and it's especially important after the C-section. The sixth step is give no pre-lacteals, no water, honey, the cultural thing, gluti or formula should be given. Only breast milk unless there is some medical indication. The reason is to prevent infection and allergies. Then the seventh step is practice rooming in. Mother and baby should be together for the 24 hours in the same room, and no routine nursery separation should be done. Benefits are there can be demand breastfeeding, and bonding should can develop between them, and thermal protection of the baby. Then the eighth step is encourage demand feeding. Feeding should not be done by clock, 8 to 12 times per day, and recognize the hunger cues shown by the baby. Step 9 is no artificial teats or pacifiers because they cause nipple confusion and reduce milk production and increase the infections. Then the 10th step is foster support after discharge. Um, we can link the facility with the LHW program, and support groups can be made and follow-up clinics should be established because this baby-friendly hospital initiative is a continuum beyond hospital as well. Now we come to the last component of today's presentation. It is breastfeeding. Breastfeeding is the natural feeding of an infant directly from the mother's breast with initiation within the first hour of birth. Exclusive breastfeeding should be done for the first 6 months. continued breastfeeding up to 2 years or beyond with complementary foods as well. So this is the physiology of lactation. It is controlled by majorly two hormones. The first is prolactin reflex, which causes milk production. Suckling stimulates the prolactin from anterior pituitary, and more frequent sucking will cause more milk production. And night feeds are also especially important in this reflex. Then the second one is oxytocin reflex, which causes milk ejection. Oxytocin is released from the posterior pituitary. It causes contraction of the myoepithelial cells. Stress, pain, and anxiety can inhibit this reflex. So the mother should be relaxed and pain-free. There is also an autocrine control. An empty breast makes milk faster than a full breast. So composition of breast milk. On the first 3 days, the milk produced is called colostrum, which is thick yellow fluid, which is rich in IgA, sorry, which is rich in IgA, leukocytes, growth factors, and it's called the first vaccine. Then, after 3 days, we have mature milk, which is either milk, which is watery and satisfies the thirst, and then comes the hind milk, which is rich in fats and promotes weight gain. It also contains lactoferrin, lysozymes, bifidus vector, and living cells that protect from infections. Exclusive breastfeeding means that a baby should be only on the breast milk. No water, honey, or any formula should be given. Medicines or ORS is allowed as per the directions of the physician. The rationale of exclusive breastfeeding is that infant gut is immature and other feeds increase the chances of infection and allergies. Correct technique or positioning is that the baby's ear, shoulder, and hip should be in one line. His tummy should be in line with the mother's tummy, and whole body should be supported. His mouth should be wide open, more areola visible above, chin touching the breast, and no pain should be caused to the mother. Signs of adequate feeding are 8 to 12 feeds per day, 6 to 8 wet diapers, and weight gain of the baby. These are the common problems faced by the mother. They can be engorgement, but of the breast, it can be solved by frequent feeding and expression. If the mother has cracked nipple, then she should check for the correct positioning or the correct latch. If she is suffering from mastitis, feeding should be continued along with the appropriate antibiotics. And there is a myth or perception in the mothers that they produce no milk, and for this we should do counseling of the mothers about the physiology or the reflexes we have studied in the previous slide. These are the nutritional advantages that the breast milk is a complete and balanced food for the first 6 months of life, contains ideal proportion of proteins, fats, and carbohydrates, suitable for infant digestion, rich in essential fatty acids, required for the brain and retinal development. Lactose in breast milk enhances the calcium absorption and promotes growth of lactobacilli, provides adequate vitamins and minerals in bioavailable forms, easily digestible, and causes less constipation and less colic pain. These are the immunological advantages. That it contains secretory IgA antibodies, lactoferrin, lysozymes, macrophages, and lymphocytes, bifidus vector, and these provide protection against the infections like diarrhea, acute respiratory infections, otitis media, neonatal sepsis, necrotizing enterocolitis in the preterm babies. Anti-infective properties like it prevents the contamination as it is clean, sterile, at right temperature. It reduces the morbidity and mortality from the infections and decreases the hospital admissions. Growth and development. The breast milk promotes optimal physical growth, better cognitive development, and higher IQ levels, enhances the jaw and dental development, reduces risk of malnutrition. Psychological advantages are that it promotes the strong mother and infant bonding, provides emotional security to the child, satisfies sucking needs and the comfort. These are the advantages to the mother as well. That early suckling stimulates oxytocin, which helps in the uterine involution, reduces postpartum hemorrhage, acts as a natural contraception through lactational amenorrhea method, LAM, and decreases the risk of cancers like breast and ovarian cancers. And it helps mother regain the pre-pregnancy weight as well. Economic and social advantages that the breast milk is cheap and freely available, no cost to the formula or the bottles, saves family income, reduces national health expenditures. A contraceptive benefit, as already mentioned as well, that it's effective when it's only effective when there is exclusive breastfeeding and infant is less than 6 months and mother is amenorrheic, and it provides about 98% protection against pregnancy. All right, and now we come to some statistics. Like this is the map showing exclusive breastfeeding where the data is from 2020, and you can see that you can see that Pakistan is in the shade ranging from 40 to 50%, and then exactly if we see the percentage is 47.84%. So this is a percentage of children who are exclusively breastfed, and the percentage is higher in our neighboring countries in India and Afghanistan. This is the share of mothers receiving at least four antenatal visits during pregnancy, and the percentage is 52.4% for Pakistan. Only 52.4% are of the women are receiving the recommended four antenatal visits, and this is the percentage. 91.2% of the Pakistani women are visited by the health professional at least once during the pregnancy. So that's as it's only a one visit, so that's why the percentage is higher than the before. So this is the share of mothers receiving medical care after giving birth, and it is 61.6% in case of Pakistan, and it's much higher in the neighbor country, that is India, but lower in Afghanistan. This is the share of births attended by the skilled health staff, and it's 68% for Pakistan, and it's the same percentage is shown by the Afghanistan. But the thing to focus for improvement is that further 32% women are there who should be attended by the skilled health staff. This is taken from the website of World Health Organization. It's simple but life-saving skin-to-skin contact immediately after birth. By 2030, nearly half of the full-term newborns in the region received at least 90 minutes of the uninterrupted skin-to-skin contact. This is a notable improvement. However, the practice remains significantly less common for preterm, so sorry, in low birth weight infants, with fewer than 1 in 4 benefiting from this essential intervention. This is the article published in this year that healthcare providers insights on the baby friendly hospital initiative. This was a cross sector study conducted in Qatar to see the knowledge of the healthcare providers. That was not good. That the study involved 141 participants. Predominantly, they were females with an average age of 38.4 years, and most were nurses, but their knowledge score was higher in males than females, and the specialist score was better than nurses. So the study highlights the need for continued baby-friendly hospital initiative education, especially for the head nurses and midwives, to enhance implementation. Because to have the implementation, the education and knowledge first have to be implemented. All right, this is the systematic review, uh, which was published this year, that the evidence consistently demonstrates reductions in the neonatal mortality along with the improvements in the breastfeeding rates and thermoregulation. Even in the poor sanitary conditions, no overall increase in the severe infections was observed. Sepsis rates are often decreased. The basic preventive measures like hand hygiene effectively mitigate any residual risk. So this was about the Kangaroo Mother care. So conclusion is that implementing breastfeeding promotion, baby-friendly hospital initiative, Kangaroo Mother care and safe motherhood strategies within the framework of universal health coverage. This is essential for achieving the 2030 Sustainable Development Goals agenda for the mothers and the newborns. At a practical level, every health facility must ensure skilled birth attendance, immediate breastfeeding support, and access to the emergency obstetric and newborn care at no financial hardship to the families. So now we come to the practice of MCQs. The first question is, a 3-month infant on only breast milk has mild diarrhea. Grandmother insists to give water to replace the losses. What is the best advice? Option A, give boiled water. Option B, start a diluted formula. Option C, continue exclusive breastfeeding. Option D, stop feeds for 6 hours. And option E, start rice water.
C.
Yes, option C is the right answer. Question number 2 is, as 1.7 kg preterm baby is on CPAP with respiratory distress. Regarding a kangaroo mother care, the correct action is option A, start immediately. That kangaroo mother care should be started immediately. Option B, wait until baby is stable. Option C, give bottle feeding. Option D, start after 2 weeks. And option E, contraindicated forever.
B.
Yes, option B is the right answer because for eligibility of this care, baby should be stable. Question number 3 is a 2 kg baby is on kangaroo mother care who gains 16 gram of weight per kg per day, feeds well and maintains the temperature. What is the next step? Option A, shift to the incubator. Option B, discharge on home kangaroo mother care. Option C, start formula. Option D, stop breastfeeding. And option E, admit in the neonatal ICU.
B.
Yes, B is the right answer. He should be discharged now. Question number 4. Whether stop feeding from painful cracked nipple. What is the correct management in this case? Option A, stop breastfeeding. Option B, continue with the correct latch. Option C, discard milk. Option D, start bottle feed. And option E, apply antiseptic only.
B.
B.
Yes, B is the right answer. Question number 5. 1.6 kg preterm is at risk of necrotizing enterocolitis. Best feeding option is option A, formula should be given. Option B, express breast milk. Option C, cow milk. Option D, glucose water. And option E, honey. Honey should be given.
B.
B.
Yes, B is the right answer. Question number 6 is, a woman with postpartum hemorrhage reached hospital but blood was unavailable for 2 hours. This is the option A, delay 1 or delay 2 or delay 3 or the community delay or the family delay.
C.
C.
Yes, C is the right answer. She reached the hospital, but the delay was in the availability of the care. Question number 7 is, a baby was breastfed within 20 minutes of birth. The main benefit provided to the baby is it prevents rickets, B reduces neonatal mortality, C stops jaundice, D increases vitamin D, and E prevents anemia.
B.
Yes, B is the right answer. Question number 8 is, a mother complains of nipple pain during sorry during feeding. Baby's chin is baby's chin is away from breast and most areola is visible below. Problem is related to option A, milk quality, option B, poor attachment, C, mastitis, D, engorgement, E, low prolactin.
D.
B.
Yes, B is the right answer, poor attachment. Question number 9 is, a woman with obstructed labor remained at home because family thought pain was normal and traditional healer was consulted first. This represents which delay? Option A, delay in reaching the facility. Option B, delay in receiving care. Option C, delay in decision to seek care. Option D, transport delay. And option E, facility delay.
C.
C.
Charlie.
Yes, C is the right answer. Last question is, in a maternity ward, a mother after normal delivery is separated from her baby for routine bathing and waiting for 2 hours before first feed. Which baby-friendly hospital initiative recommendation is violated? Option A, step 2, the staff training. Option B, early initiation. Option C, no pre-lacteals. Option D, demand feeding. And option E, no pacifiers.
B.
Yes, B in this case, early initiation of the breastfeeding. This is the answer key to all of the questions. This is a YouTube channel of IPH Institute of Public Health Lahore, where this presentation will be uploaded. Thank you so much.